Good morning, Mom. I'm your Grace Swanner.
And I'm Charmy Piozoa.
So we're going to assessing an apical.
And radial pulse.
So first, we need to assess the clinical signs of hypovolemic shock.
Next, we need to assemble all the equipment such as watch that has second hand or indicator, and then the stethoscope and the antiseptic wipes.
Then next, we need to introduce ourselves to the client and verify the client identity and explain to the client what you are going to do, why is it necessary, and how the client can cooperate.
So, good morning, Mom. I'm Charmy Piozoa.
And I'm your Grace Swanner. So we are your student nurse for today.
So, can I ask what is your name, Mom? Your age, Mom? And how about your birthday?
October 20,000.
Okay, Mom, thank you. Then after that, let's perform a hand hygiene, and then let's assume that we already
Done performing
performing
hand
hand
hygiene.
hygiene.
Then after that, we need to provide client privacy.
And then next, we need to position the patient in the appropriate position or in supine position.
Then after that, we need to locate the apical and radial pulse site.
So, Mom, we are now going to assess your radial and apical pulse, Mom. So, is it okay to you, Mom, that we expose your chest area? So, next, firstly, the earpiece of the stethoscope. Using the antiseptic wipes. And the next, let's clean the diaphragm of the stethoscope. And the next, before we put the diaphragm to the patient, make sure that the diaphragm is warm.
Then after that, place the watch, making sure that both nurses can see it. So I'm the one who assessing her radial pulse. So I'm the one who says start or stop. So right now I'm going to assess his radial pulse for 60 seconds.
And I'm going to assess her apical pulse for 60 seconds.
Start. Stop.
So after we take the radial and apical pulse of the patient, let's document the result. So I get 64 beats per minute for the apical pulse, and the rhythm is consistent, and the volume is bounded.
Then I get the 64. I get the radial pulse for 64 per beat per, and I get her radial pulse 64 beat per minute, and her rhythm is consistent, and the volume is bounding.
That's all. Good morning, Maha. I'm Charmy Piozoa, and I'm going to assess the respiration and the measurement of the oxygen saturation. So first, we need to assess the clinical signs of skin and mucous membrane color, the position assuming for breathing, and the signs of cerebral anoxia, the chest movements, the activity tolerance, chest chest pain, dyspnea, medications affecting respiratory rate. So next, we need to assemble all the equipment such as wristwatch that has second hand or the indicator, and then the nail polish remover as needed, the pulse oximeter, and then the antiseptic wipes, and the sheet or towel. So next, we need to introduce ourselves to the patient, and then identify a verified client's identity, and then explain to the patient what are you going to do and how the patient can cooperate. And then perform hand hygiene, and let's assume that we already done performing hand hygiene. Let's provide the patient privacy, and then let's put our patient in a comfortable or an appropriate position for its supine position. And then next, let's observe or palpate and count the patient respiratory rate. But we need to make sure that the patient didn't notice that we count his or her respiration for her to feel comfortable and not conscious. And then make sure that the patient nails has no nail polish to avoid a false result. And then, okay, ma'am. I'm Charmic Yuzo, ma'am, and I'm your student nurse for today. And I will be going to assess your respiration and oxygen saturation. The next, you need to clean the area where you're going to put the pulse oximeter. And then after you clean the area, insert the pulse oximeter to the index finger of the patient, and then put his or her hand over her chest, and then start counting her breathing for 30 seconds. Okay, I'm done counting her breathing. Let's remove the pulse oximeter, and then let's document the result of the patient. So the patient's RR is 8, and let's multiply it by 2. The patient's RR is 16, and her pulse rate is 99. And the depth is shallow, the rhythm is regular, and the character is quiet. That's all.